Okay, folks, good evening and welcome to the Q&A session on canine intervertebral disc disease with Paul Freeman and Sam Khan from Cambridge Veterinary School. Delighted to have them with us this evening. Sam's run a couple of presentations for us previously, and if you've not had a chance to watch those videos, they are on dachshundhealth.org.uk, so you can tap into those videos as well. I'm just going to hand over, I think, to Paul to start with. So the agenda for this evening, just a very quick introduction from Paul about the work that's going on at the Cambridge Vet School on the IVDD project, and then we'll move into the Q&A session. So if you do have questions that you've not asked prior to the session, please drop them into the chat window. And folks, I'm going to put people on mute who aren't on mute. Paul, over to you.
Thanks, Ian. Yeah, you can probably control that meeting, being chair of the meeting. Anyway, I can hear a few dogs in the background. Thanks very much, and it's really nice to be here. I said kind of tongue-in-cheek that I couldn't think of a better way to spend a summer evening than talking about intervertebral disc disease, but Sam and I can talk about that for a very long time these days, and so it's nice to be able to share a little bit of what we're doing. Just for those of you who don't know what we're doing at Cambridge, we set up a study which began in October last year. It forms a central part of Sam's PhD that he'll be doing for this next 3 years. And what we're doing is we're recruiting small breed dogs, a lot of Dachshunds, obviously, that suffer intervertebral disc extrusion, or are believed to have done. But for whom the sort of traditional route of MRI or CT scan and surgical treatment is just not an option for financial reasons. And we are taking those dogs and counselling the owners. We're giving them an MRI scan to confirm the diagnosis, and then we are basically providing assistance and help with medical rehabilitation, medical treatment for a period of basically 3 months. And then we're asking them to come back. We're giving a second MRI scan so that we can see what's happened to the disc extrusion over that period of time. And also, obviously, assessing how well the dogs are doing. And up until now, I think Sam will correct me, but I think we're just over 20 dogs recruited, which is fantastic. And that all of these dogs are non-ambulatory, so they're severely affected. We're not taking dogs with just back pain, and we'll discuss that later if anyone wants to know why, but we're only interested in the more severely affected dogs, the ones that at the moment most people would recommend surgery on, and that includes the most severely affected, the ones that are deep pain negative, that are paralyzed and have lost their sensation. And what we're seeing at the moment is really a quite astonishing recovery rate. I was saying to Ian, we're very disappointed when we have a dog that doesn't recover right now. Obviously, they're not all recovering, and that would be very, very unlikely. But we're seeing a very good recovery rate, and we're also seeing some very interesting things with the second MRI, with extrusions just basically disappearing over that period of time. So it's going to be very, very interesting when we sort of collate all this data. Probably in another year or so's time, we'll carry on recruiting cases over that period, and then hopefully get it out there. And our aim really is to try and provide better information about which dogs really need surgery and which dogs could reasonably be managed without surgery. And that's really the ultimate goal of all of this. So, yeah, I think that's probably enough of an introduction, Ian. So,
okay.
Happy to carry on with some questions, or at least let Sam answer the questions.
Great. And Sam's slide presentation from the last webinar, which has some of those emerging findings, those are available on our website, dachshund-ivdd.uk, for people to have a look at as well. So the first question, I'm not sure which of you want to take this, something about, is there any significance of the back left leg going first? Somebody's read that the left leg tends to be the one that goes first if a dog starts going wobbly.
I'll,
Any
I'll,
evidence?
I'll take that one and just say that as far as I'm aware, there's literally no evidence that one side or other being affected first is of any significance. Usually there is a degree of asymmetry to the extrusion, and usually one side, at least initially, is a little bit more severely affected than the other. But as far as I'm aware, there's nobody's actually probably looked at it, to be truthful, but there's certainly no evidence, anecdotally or otherwise, that one side going first carries any influence on the prognosis, shall we say.
Right. Okay. Thank you. Second question: after a year of physio, can I expect more progress? My dog's young, he's got some bowel and bladder control, can move her tail and legs a little, spinal walk. We also do physio at home. What's the prognosis after that sort of length of time?
Sam, do you want that one?
Yeah, I can take that one. I can take that one if you like. It's a difficult one without knowing the dog individually. So, we kind of got to answer it in a very general sense. And it also depends a little bit on the kind of grade that you're affected. Normally, we would say that for dogs who are grade 5, have not got back to their deep pain sensation, then after a year, they're probably quite unlikely to do so. However, certainly you can see some effects in terms of spinal walking, sort of well into the significant future. For those who have, then it's probably more about kind of goal directed and trying to make sure that you're trying to achieve something with your physio. Have you seen noticeable kind of muscle loss there, muscle weakness, and trying to target those kinds of things? Because really, from a neurological sense, in a year, the spinal cord is going to have done what it's going to do, the disc material is going to do what it's going to do. So often it's trying to evaluate from a kind of away from the spine almost, and maybe a bit more goal directed with your physio. And I think it's probably best in those scenarios to sit down with your vet, sit down with your physio, and think, okay, what are we trying to achieve here, and how can we best go forward and try to achieve that?
I think just sort of building on the work that you're doing, you're evaluating up to, is it a 12-week endpoint?
Absolutely, 12 weeks, yeah.
And what sort of progress are you seeing in that 12-week? What recoveries are you seeing?
Probably more significant than actually we were expecting. We were thinking, 12 weeks is going to be a little bit of a blink of the eye in terms of their recovery. But as I think I said in the presentation last time, we've had, for dogs to recover the ability to walk, the average number of days has been 17.5 days. So just over 2 weeks actually to recover to walk. So pretty quick. By the end of the 12 weeks, an awful lot of dogs are, in fact, a vast majority of those who recover the ability to walk are practically walking normally. There's actually not a huge amount of space for them to improve after the 12 weeks. They're all doing, the vast majority of them are doing amazingly well. Certainly some of them who we've kept in touch with have seen improvements for, at least 3 months beyond that. But we haven't been live for over a year yet, so to know whether any of them have continued to improve beyond the 12-month mark, I guess we'll have to find out in the near future. Are you
collecting data on that? Are you collecting data?
We're trying to keep in touch, absolutely, with as many people as possible in the long term to see, at what point things stop improving. When can we expect things to stop? So yeah, we're definitely trying to stay in touch with as many people as possible. So hopefully, when I chat to all of them a year down the line, we can have some good data on that.
I think just to touch on the questioner mentioned spinal walking. I'm not sure that everybody knows what we mean by spinal walking. Dogs that don't recover their pain sensation, so dogs that suffer the most severe level of spinal cord injury, they're paraplegic and they lose their deep pain sensation. At the moment, we know that approximately 50% of those dogs will recover with surgical treatment. That's what we tell people, and that's what has been shown with evidence. And without surgery, a very much smaller percentage, well, almost down to zero, is what is currently believed. But we're certainly proving that wrong at the moment. But there is a significant percentage of dogs that won't recover the ability to walk when they have that level of spinal cord injury. And that's why this disease is so feared amongst certainly many owners of Dachshunds for sure. And there is this phenomenon called spinal walking, which we see in a percentage of dogs that don't recover their sensation or their ability to walk normally. And that normally takes several months to develop. We don't know whether it can be encouraged by appropriate rehabilitation and physiotherapy. There's a lot of work being done on that, I know, at the moment, or some work being done on that at the moment, because it would be a very useful thing if we could find a way to actually induce spinal walking in dogs that haven't recovered their ability to walk. And I think it's unlikely. Most dogs that haven't recovered the ability to walk by 3 months are probably not going to, and we're then into that period of will they get spinal walking back or not.
Right.
And spinal walking is a peculiar phenomenon, and it's where we have these things called internal pattern generators within the spinal cord. So in an area of the spinal cord, it's possible for nerves to stimulate walking-like movements in the back legs without the control that normally comes from the brain channeled down the spinal cord, because the spinal cord is too damaged, that control can't happen. So it's locally generated within the spinal cord. So the movements are very sort of uncoordinated, kind of stiff and weird looking, but they can get the dog mobile again. And that's spinal walking. And usually probably at least 5 or 6 months for that to develop.
Okay. So sort of building on treatment and recovery, there's a question about hyperbaric oxygen therapy, which I think we've heard with footballers probably after injuries and sports people. Is that something that is being used or has any relevance in recovery? And the question is either conservatively or post-surgery.
Yeah, I'm happy to take that one. So for anyone who's not aware of hyperbaric oxygen therapy, it's essentially being put in a chamber of 100% oxygen, so much higher oxygen percentage than room air, and also at higher pressure than air. So the idea is that it's helping the oxygenation of your tissues effectively. And the theory, at least in terms of disc disease, is that can help with some of the sort of consequences of the spinal cord being damaged. To date, there haven't been any studies at all in dogs with interlateral disc disease. So certainly there's no evidence for it being useful in that sense. There has been a study into experimental spinal cord injury, so where they, in the study, physically caused the damage, so not the same as a disc, and they didn't really find a huge effect. So I don't think, certainly there's no evidence to recommend it at all at the moment, or suggest that it may be helpful, but I would imagine there'll probably be more work done in the future to try to determine whether it is.
I would think
sounds a bit niche.
Mm-hmm.
Yeah, I would think, intuitively, the only sort of time frame when it could potentially be helpful would be very early after the disc extruded. So in that period of time where the spinal cord is contused, that contusion element to the injury is the thing we really don't have any way to target right now. And improving oxygenation of the neurons in the spinal cord in that moment potentially could have some benefit, but being able to do that and just logistically, I would think would be very, very difficult anyway. Doing it further down the line, a week after the injury or more, I really can't see how that's likely to be helpful, to be honest.
Okay, thank you. We've got a question about calcification of the discs, Paul, and you may want to just make some comments about the screening program that the Kennel Club has just launched as well. So the question is, if the majority of discs are calcified in the spine, does this mean the dog will continuously suffer from episodes of IVDD?
Yeah, that's a good question, isn't it? We know that calcification is related to extrusion. It's certainly in Dachshunds and almost certainly in other breeds as well. We know that Dachshunds discs do calcify quite quickly in life, and in a lot of Dachshunds, a lot of discs calcify. What we don't know is exactly the role of that calcification in terms of how it is related to extrusions. What calcification does to the disc precisely that makes it more likely to extrude, because there are plenty of dogs that have lots of calcified discs, but they don't all extrude. We know that the more calcified discs you have as a young dog, the more likely you are to suffer an extrusion at some point in your life. And that's a relationship that's been sort of shown fairly clearly. What we don't know is, if there's a cut-off point below which or above which you're more or less likely to have an extrusion. These things are still really being unraveled. And as part of that unraveling, as Ian said, the Kennel Club has just this week launched a new screening scheme specifically for Dachshunds, where you can have your Dachshund x-rayed at a nominated centre under sedation. And the x-rays are then sent to a panel of scrutineers who will assess them for calcification in the discs, and allot each dog a grade according to the number of calcified discs. And then there are recommendations or advice available in terms of using those dogs for breeding according to the grade that they're given. And running alongside that, as part of Sam's PhD, we're hoping to perform CT scans on as many of those dogs as possible at no extra cost, because CT is a much more sensitive way of identifying disc calcification. So what we're hoping to find is the answer to some of or potentially the answer to this question in terms of numbers of calcified discs, because we know from a little pilot study that we've done, dogs with 2 or 3 visible calcified discs on X-ray can sometimes have in the teens of calcified discs on CT. But we don't really know how significant that is in terms of future disease. I think coming back to the answer to the question, a dog that has multiple calcified discs is not necessarily destined to have multiple extrusions. And I think, I wouldn't want people to think, if they have their dog x-rayed and find lots of calcified discs, that is a sort of a death sentence or a life sentence of back pain or whatever, because it's really not. We really don't know that. What we know is that they're probably more likely to suffer at least one extrusion in their life. And whether you can do anything to prevent that is another very difficult question to answer, to be honest. But you can at least be prepared for it, I suppose.
And some of it goes back to lifestyle factors and the genetics of it as well. And we know from certainly our recent breed health survey, again, we've reproduced the findings that dogs that have been neutered under the age of 12 months are significantly more likely to have disc herniations than dogs that are either not neutered or are neutered later in their life. So there are definitely lifestyle factors that can influence the risk associated with it. And the screening program is very similar, Paul, isn't it, to sort of hip and elbow screening?
Yeah.
It's about risk. It's not an absolute certainty that a particular grade will result in a particular outcome.
Absolutely. Yeah, absolutely.
Okay, good. Moving on to another question, which is about MRI rather than CT or X-ray. Reading the comments on our Facebook group, seems that most dogs are having MRI scans followed by surgery. At what stage would we decide we'd rather manage the pet rather than let it have surgery? One assumes the surgeon knows best.
Can you just say that question again, Ian? I'm not quite sure exactly.
Most dogs are having MRI scans followed by surgery. So I guess that's, once they see the results of the scan, there's an almost presumption, that you will go to surgery. At what stage would we decide we'd rather manage it conservatively rather than go down that surgery route?
Okay. Yeah, I mean, that's a very good question, because I think once you have been referred to a specialist, for investigation with your dog suffering a presumed disc extrusion, then obviously you are to a certain extent in the hands of that specialist, and you have to trust them and trust their advice. And for diagnosis, MRI probably is the modality of choice, although CT can give very good results in terms of disc extrusion as well. MRI is often preferred because it will show us things other than just disc extrusions and disc calcifications. If we're sort of 99% certain it's going to be a disc extrusion, then CT is quicker and will give us the answer. So that is really just a choice for the individual and doesn't really affect what we're then going to do with the results. In terms of decision making once you've had the MRI or the CT, that does come down to obviously taking the advice of the neurologist or surgeon that you're with. And you know, currently most surgeons, most neurologists, if a diagnosis is confirmed of a disc extrusion, and certainly if the dog has been rendered non-ambulatory, unable to walk as a result of that extrusion, the current advice would be surgery is more likely to give you a good outcome than medical management and rest. And you know, we would go along with that at Cambridge, even though we're running this study. If we have a dog that loses the ability to walk and we confirm a diagnosis of an extrusion, we would recommend surgery if the owner was able to afford to go down that route. It may be in the future, once we get Sam's results collated and published, that those guidelines might change, and I certainly hope that they will, and we'll be able to be a little bit more specific in terms of perhaps looking at the MRI or the CT, looking at the dog and saying, well, actually, this dog has, let's say, 80% chance of recovery without surgery, maybe 85% with surgery, something like that. You know, that's a pretty good odds to go without surgery. But at the moment, we don't have that data to be able to say that. I think dogs that don't lose the ability to walk, there are many specialists who would recommend medical management for those dogs. May still have an MRI or a CT to confirm the diagnosis. But I have to say, you know, for me, sometimes if we're presented with a dog, which again, you know, we can be often 90–95% certain that we're dealing with a disc extrusion if we have, you know, the right breed, the right age, the right presenting signs, the right history. You know, there are not too many other diseases that will mimic that process. So you can be reasonably certain. And if we feel we're not going to go to surgery, then I will often advise or counsel that maybe it's not worth doing the imaging at that point, just to confirm what we pretty much already know. And maybe we just instigate the medical management. And if we start to see signs of improvement, then we know we're in the right direction. If we don't start to see signs of improvement, well, then we have to reconsider whether we should do the imaging or not. But these are difficult choices, and they're quite difficult choices even for us as specialists, because, you know, there is to some degree, there's a climate of fear around going with medical management, because we are all afraid of the dog that begins medical management and then ends up going down to paraplegic and losing deep pain sensation when its chances of recovery are much smaller. And
oh, I think we've lost you, Paul.
You know,
Paul,
did I just freeze?
You're cutting out with your connection. Are you back again?
I'm back again.
Yeah.
Sorry, that was a bit of a long answer to a short question.
No, that's all right. And it's a question that gets asked quite often in the IVDD Facebook group. You know, people come in and say that their dog is wobbly, and the immediate reaction from lots of people is, well, it needs to have an MRI scan. And it sounds like, from what you're saying, if it's still a grade 1 or a grade 2, you may not even opt to have the imaging done. But it is that trade-off decision about, will it get worse, will it deteriorate? But I think the evidence these days is that it's not such an urgency to go in and operate in terms of outcomes. That there always used to be you must operate within 48 hours, otherwise the dog's not going to recover.
Yeah. There's been a lot of work published in the last few years that's kind of gone against that idea, that timing, there may be an element of timing, but probably we rarely see the dogs quick enough to be able to actually exploit that. So, in terms of sort of human decompressive surgery, if you can get in within sort of 6 hours of the trauma, then potentially there might be a benefit. But, with most of our dogs, that's just not a possibility. And the evidence is that actually, the timing doesn't matter. We're certainly seeing plenty of dogs where, they can have been paralyzed for days. We'll operate on them and they'll still get better. So yeah. I think that element of timing is largely been sort of disproven. We'll wait and see whether it comes back onto the table in future years, but at the moment, not so much.
But you don't actually know when the clock starts ticking either.
Well, exactly.
That's the point.
That's exactly. Yeah.
Okay, good. I think we've got a surgery question for Sam, probably, which builds on a previous presentation. Sam touched briefly on prophylactic fenestration in his presentation last time, and this questioner wants to know what are your thoughts on percutaneous laser disc ablation, which I know I've read about and seen described in the United States, but not heard anything much about in the UK. Sam, is that one for you?
I think this one might be for Paul because he's looked into it a fair bit fairly recently, or at least telling me that he has been. So
go on then.
It's a bit niche. It's, as far as I'm aware, it's not available in this country at all. Basically, there's a group in the States, I think it's Oklahoma University, who've been doing this for a few years. And what they do is whenever they have a dog that has surgery for a disc, they get them back 6 weeks later, and they insert a needle into each disc under fluoroscopy, and then put a laser down through the sort of stellate of the needle into the disc, and actually just literally laser the nucleus pulposus, the center of the disc. And they have shown that doing that reduces recurrence rates, and their dogs have a recurrence rate of, I think, 3 to 5%, something like that, which is low, and lower even than sort of traditional fenestration techniques. So, it could be, and I think it probably is, a very useful technique. They don't do it at the time of surgery because they're afraid that lasering a disc that's already ruptured could allow an escape of heat into the spinal cord itself. So they wait this arbitrary 6 weeks before they do it. Mm-hmm. We don't know whether that's necessary or not. I have to say I'm quite interested in this technique, and I would like to learn how to do it and to consider bringing it to the UK. But at the moment, it's not available. And I think it will be a while probably before it is, but there are people around who are interested and sort of considering it, shall we say.
And are there published papers on it as well? Yeah,
absolutely. Yeah. There are two or three big studies from this one university, and another one which will be published soon, which I just reviewed. So.
Right. Okay. Got a question on dogs that have problems with their neck rather than lower down in the spine. Notice that a lot of older dogs get neck problems rather than lower down. Is this caused by strain of using their upper muscles to compensate with loss of lower leg muscles, is the question. Any sort of relationship between muscle power or muscle strength and why a dog might herniate in the neck in older age? Is it just randomly?
No, I don't think there is. Sam, what were Jad's figures recently? We have one of our colleagues at Cambridge who's been looking into the distribution of where discs extrude across 3 different breeds, actually: Dachshunds, French Bulldogs, and Cocker Spaniels. And I'm pretty sure the rate in the neck in Dachshunds was tiny, actually, wasn't it?
Exactly. Yeah, absolutely. So I was going to say it's an interesting observation because it's not borne out by Judd's data. Effectively, as you say, that there were tiny percentages of Dachshunds who were getting discs in their neck. It was well under 10%. that were getting them, and generally there wasn't a trend for them to be any older. Actually, they were presenting basically at the same age. It was much more common in both French Bulldogs and Cocker Spaniels. One of French Bulldogs present at a much younger age, usually around 3, and Cocker Spaniels are a little bit older. Their average age is around 7 or 8, compared to sort of 5 or 6 for Dachshunds. So it's an interesting observation. It's not something that we've seen looking back at our data, I have to say.
So it's more anecdotal by the sound of it. And actually, just picking up your figures, we've got 2 breed surveys. One, I think it was 5% in the neck, and the other one was 10%. So your 5 to 10% range is fairly typical by the sound of things. It's definitely 90+% in the is it T12, T13?
Yeah, T12, 13, T13, L1, L1, 2. Yeah.
Okay, good. Thank you. Question about somebody who had an MRI scan and opted not to go for surgery, seeing improvements. Can they still have full use of their limbs, bladder, and reflexes and really still require surgery? I guess the question is about when's it right to make the conservative decision versus the surgery decision? We've touched on it a little bit, but your view on that at all, Sam?
Yeah, I think as Paul said before, unfortunately, the data at the moment suggests that for dogs who have lost the ability to walk, we have to, where possible, recommend surgery, because at the moment it suggests that is your best opportunity to get back up on your legs. And but for those dogs who are still able to walk, it's certainly a lot of neurologists would be more than happy to recommend conservative management. But as Paul says, the trade-off is that there's the potential for that deterioration. Certainly, I think what we've shown with our data is that where surgery is not possible, no matter how badly affected you are, there is still an opportunity. There still is a chance that you will be able to have your dog get back up on their legs, retain their bladder and bowel function. So certainly there is an opportunity.
Okay, and I think the next question, Sam.
Ian,
sorry.
I think that question really more asking if there's a situation where a dog hasn't lost the use of its legs, where surgery is still the best option. It sounded as though the dog was perhaps hadn't lost the use of legs, bladder, bowel, etc., had an MRI and surgery was recommended.
I think they're saying they were asked for consent for surgery and opted not to go for it. Yeah.
It's it's a difficult question to answer on an individual basis. What I would say is that I think one still good indication for surgery, for me anyway, is dogs that remain painful. There are some dogs that have an extrusion that maybe don't ever lose the ability to walk, maybe don't even suffer particular neurological deficits or weakness, wobbliness, but just have a lot of pain. And there are some of those dogs that we struggle to get over the pain. I have to say probably less in the Dachshund than some other breeds. But I've had dogs where we've ended up MRIing them. We've seen a sort of a big extrusion, but the dog's running around quite happily, but just painful. And that pain just never goes away. And we end up operating on those dogs to get rid of the pain. And it does get rid of the pain, I have to say.
Yeah.
So.
Okay. And I remember talking to another veterinary surgeon saying that certainly with discs going in the neck, those are incredibly painful to start with, and the surgery instantaneously eliminates the pain. So if it's a cervical disc going, then surgery sounds like a very sensible option, doesn't it?
Yeah.
Okay. Building on that question about conservative, at what point do you start rehabilitation with approaches like physiotherapy, hydrotherapy, or acupuncture? And Sam, that's probably conversations that you're having with your research project candidates all the time. When do you start those sorts of therapies?
Absolutely. I think, we start them very early on. We actually start them as soon as they come to the hospital with very basic levels of physiotherapy. I think the important thing to note is that physiotherapy encompasses a very wide range of kind of exercises, and different ones are appropriate at different stages, but there is pretty much at least one or two exercises that are appropriate for pretty much any stage. So they start with, certainly for us, massage and passive range of motion as soon as they are here with us in the hospital. In terms of hydrotherapy, that's a little bit further down the line. We haven't recommended hydrotherapy or had anyone undertaking hydrotherapy that's been included in the study. But generally, the recommendation would be to wait until you're at the point essentially where there's minimal risk of more jam being squeezed out of the donut. So often that's a little bit further down the line. Acupuncture, however, I think Paul actually looked into this a little while ago. When you would quite start that, we haven't been doing it here. I'm not sure when people have been starting it in the other studies then.
No, I don't know. There are, basically what I know is that there are some good studies that show or appear to have shown that acupuncture is beneficial in dogs that are managed medically. But, you know, these actually were studies not carried out in the UK. And there are not many people sort of offering that as a real sort of positive treatment, shall we say. But there are acupuncturists around the country who generally speaking would probably offer it more as a way of treating pain associated with these situations. And I think the other thing to say with regards to the rehab is that we also try, perhaps less so with Sam's study candidates, but we with the clients that are referred to us at the hospital, we try to point them in direction of a well qualified physiotherapist or rehabilitation practitioner to give the best advice, because with the best will in the world, we're not physiotherapists, and what we do is still relatively basic, I would say, on that level, and I think there are people out there who can probably do a lot more.
Thank you. And Sam kindly provided us with some notes for our website, I think after the very first webinar on conservative treatment approaches. So please, again, have a look on the research page on dachshund-ivdd.uk, and you can find Sam's notes on conservative treatment in there. I've got, I think, run out of all the pre-workshop questions. I've got one from Victor in the chat. Any update on how cases of PMM compare to those treated surgically? I assume PMM is myelomalacia?
Yeah, probably. So it's still a little bit early for us to sort of say, but it would probably take a huge number of dogs actually for us to really say definitively either way. And the rate we've had so far, the fact that certainly for grades 3 and 4, we haven't seen any who have then progressed to that wouldn't be unusual for the number of dogs that we've had. And the same would apply for grade 5 dogs. So I think realistically you would need hundreds and hundreds of dogs to find that. So certainly we've got 24 so far. I think we're far too early, unfortunately. As much as I would love to answer the question, I think we're far too early on in that sense.
Right, thank you. And I've got a hand up from Charlotte. Please ask a question, Charlotte. Come off mute.
Hi, just touching on the hydrotherapy part, and you said not to start it until the risk of the jam coming out of the disc is over. How long would you say that is?
That is the immortal question, I think, is the answer. Certainly there is no good sort of timeline that is definitively set in stone for when that stops. In fact, some papers have actually shown that it takes an awfully long time before that happens. I think for us in our study, we start to sort of allow dogs to be starting to do a little bit more after about 4 weeks, and it's a bit of an arbitrary number, but it seems to be working okay for us at the moment. But it is a little bit of an arbitrary number. It is kind of golden question, and certainly certain studies have shown that it can take even longer.
Sorry. Only an owner recently, their Dachshunds had hydrotherapy. I think it's probably 2 or 3 weeks into recovery, and shaking off after getting wet in hydrotherapy. The dog has had a setback and possibly going into more surgery. So
that's a really sad story, isn't it? We I mean, we sort of slightly arbitrarily, as Sam said, there's evidence that if your dog has a relapse within the first month, it's usually the same disc that's gone again. Whereas if it has a relapse after a month, it's usually a different disc. Now, that's not a hard and fast rule, but that's the evidence that we've got. And so from that, we tend to take the month as being perhaps the length of time that it takes for the hole in the disc to fill in with something, even if it's not healed properly, but fill in with fibrous tissue or whatever to reduce the risk of a further extrusion. And what we tend to say is to avoid the sort of free swimming version of hydrotherapy, where again, quite arbitrarily, and I don't have any evidence for this, but just imagining dogs swimming and the movement in the spine involved with free swimming, and it's that sort of potential squashing of the discs that could be involved with extension of the spine in free swimming is likely to be a risk factor. Whereas, water treadmill hydrotherapy, where they're just literally on a treadmill and walking, be encouraged to walk with a little bit of buoyancy, extra buoyancy from the water, I think that can be beneficial much earlier, because the risk would be much less. Obviously, I haven't even thought of the dog shaking coming out of the water and potentially hurting himself that way. But that these are the kind of ideas that we have that as I say, not a huge amount of evidence behind them really, but hopefully a little bit of common sense really.
Yeah, because we advise owners not to bath the dogs post-surgery because of the shaking off.
Yeah.
But if the dog is comfortably enough following surgery, it's going to do a full body shake. That's what you hope for anyway, isn't it?
Exactly. Yeah.
It's the disc's either going to go or not. You can't stop the dog from doing their full body shake, is what you're hoping for.
Exactly.
Okay, lovely. Thank you. Thanks.
Thank you, Charlotte. We said this session would probably be about 45 minutes, and it's now 7:44. Are there any other questions from our guests before I ask one maybe final question about the research program that's going on? Anybody else like to ask a question? Patricia, please come off mute.
Hi.
Hi.
Hi. I just would like to say how indebted I am to my vet, because when my dog a year ago started suffering IVDD, it was very new to me, and I had read online that you must have, as you've just said, you must have him scanned and you must have an operation within hours. And I went to my vet, because I'm insured, I went to my vet demanding these things. And he said, wait, now just wait here. He said, I would like to take the conservative approach and cage rest him. And I have to say, I am so indebted to my vet for calming me down. He obviously was only stage 1 or 2. I understand that, where you're treating much more serious dogs. But I would just like to say what a great vet. There are I hope some more good vets out there that don't push you along the surgery route.
Absolutely. No, there definitely are. But it takes courage to do that.
Yes.
You would have been in the consulting room, effectively pressurizing the vet to send you off somewhere to spend a huge amount of money and put your dog through MRI and surgery. And it takes a fairly experienced and courageous vet to actually resist that, to be honest. And so, I would say you were lucky.
I am. I'm very lucky. Thank you. And I'm so grateful to have these seminars too. It's lovely listening to you and trying to do the best we can. Now my dog's over IVDD, at least one session anyway, and do the best for him. Thank you.
Thank you, Patricia. Thank you. And I guess, Paul, if the client sat there with an insurance policy for the dog as well, it's the easy option to say, yeah,
well, you know,
refer you for an MRI.
Unfortunately, you know, we do live in a climate now where you know, people do sue you for doing things wrong, or for, you know, advising incorrectly. I use it in inverted commas, you know, and so especially for the, you know, I mean, obviously I teach the students at Cambridge, and you know, I feel for them, to be honest, because they're going out into a world that's not like it was when I graduated many years ago, and you know, people are prepared to make serious complaints, to take you to court, and you know, and so they are working against that backdrop as well, and so, you know, I would never criticize anybody for recommending or referring a dog in that situation, Patricia, for at least for the specialist opinion, because you know, they yes, to a certain extent probably they are covering their back in that situation, but you know, absolutely no reason why they shouldn't do that. But you know, if you do have a vet who is able to sort of take that route and give you that advice, then you know, that's great.
Yeah,
I think that's going to be very dependent on that individual vet's experience, isn't it?
Yeah.
Paul,
Yeah,
and
absolutely.
familiarity with the breed. Because
Absolutely.
we've certainly found in various polls that we've done in the group, you know, a third of vets don't correctly diagnose on first presentation,
Yeah.
and another third get it wrong.
Yeah.
So it's, although it does put pressure on to say, well, let's refer, doesn't it?
Yeah,
I suspect
it does.
I've got one more question in the chat, which goes back to your research. Victor, again, saying, I seem to remember you were also looking at the composition of the calcified disc material.
Yeah.
Is there any update on where you're going or what you're finding with that?
Yeah, that's also another very sort of exciting avenue that we're exploring slightly differently. That's a different student who's really running that project, but working quite closely with Sam. And yes, we are finding some very interesting results there, actually, in terms of how the calcification process progresses. What we are, you know, really hoping we might be able to find is a way of actually potentially interrupting some important steps in that calcification road, which could potentially, if we're able to, lead to a you know, a reduction in the number of extrusions that occur. So that's where we're going with that research. It is still quite early days. We've got that project sort of running now. It's going to run for at least another year, hopefully anyway. And we are hopeful that we will have something quite positive from that. I'm reluctant to say too much at this stage because I don't want to give too much away, to be perfectly honest. But it's quite exciting.
Great, good. Are there any more questions from our guests this evening before we draw this to a close? I can't see any more hands up. So on that point, I will thank both Paul and Sam for their contributions. Really appreciate you taking the time this evening to answer the questions. Appreciate all the pre-seeded questions from people on our Facebook group. And if you want any more information about the research project, if you go to www.dachshund-ivdd.uk, we have a research page, and there's a tab on that page which has got all the material and updates of Sam's presentations from previous webinars, so you'll be able to keep in touch. And Paul, do you want to do an advertorial for your social media channel and your sponsors at all before we close finally?
Well, social media, I'll leave that to Sam, actually. In terms of sponsors, our work is being sponsored by a number of people. Certainly Dachshund Health have been very helpful to us and are partly sponsoring Sam's PhD, which is really amazing. We have a good deal of sponsorship from the Kennel Club Charitable Trust. We have a grant from Pet Savers, which is the Small Animal Veterinary Association charity. And pulling all that together is basically what's allowing Sam to eat and also conduct some research. So we're very, very grateful for that, because without that sponsorship, this work wouldn't be able to happen. You know, we're able to give these MRI scans a very, very reduced cost to people. We're able to keep the cost to a minimum, and still get some really interesting work done.
Great. Sam, do you want a final word?
Yeah, absolutely. So as you said about our social media, you can find us on @Cambridge IVDD on Facebook. I haven't quite managed to get the hang of Twitter or Instagram yet, but when that comes, I'm sure that I'll try and make the handle exactly the same. So keep an eye out for that. And yeah, thank you, Ian, and thank you, Paul, and thank you for everyone coming and everyone who answered the questions as well.
Great. I'm going to stop the recording now. Thank you very much, everybody.